Good morning, everyone. My name is Ian Kelly Sarmiento. My report is all about bipolar disorder. What is bipolar disorder? Bipolar disorder is also known as manic depression is a mental illness that brings severe high and low modes and change in sleep, energy, thinking, and behavior. People who have bipolar disorder can period in which they feel overly happy and energized, and other period of feeling very sad, hopeless, and sag- sluggish. In between those periods. They usually feel normal. You can think of their high and low or two poles of mood, which is why it's called bipolar disorder. The word manic describes the times when someone with bipolar disorder feels overly excited and confident. Their feel can also involve irritability and impulsive or reckless decision making. About half of the people during mania can also have delusion, believing they're not true and they can talk out of or hallucination, thinking or hearing things that are not there. Hypothermia describes milder symptoms of mania in which someone does not have delusion or hallucination and their high symptoms do not interfere with their everyday life. The word depressive describes the times when the person feels very sad or depressed. Those symptoms are same as the described in major depressive disorder or clinical depression, a condition in which someone never had manic or hypomanic episode. Most people with bipolar disorder spend more time with depressive symptoms and than manic or hypomanic symptoms. Bipolar disorder types. There are few types of bipolar disorder, including bipolar 1 disorder, which is type you can extreme erratic behavior with mania up period that last at least 2 weeks or are some severe and that you need medical care. They are also usually extreme down period than last 2 weeks. Bipolar 2 disorder. With this type, you also have erratic high and low but is not as extreme as bipolar 1. Schizotropic disorder. This type involves period in manic and depressive behavior that lasts at least 2 weeks, 2 years in adult or 1 year in child and teen. The symptoms are not intense or bipolar disorder 1 or bipolar disorder 2. With any types of bipolar disorder, issue that drugs and alcohol use can lead to more episodes. Have this bipolar disorder and alcohol use disorder known as dual diagnosis. Required help from specialists who have addressed both issues. Bipolar disorder symptoms. In bipolar disorder, the dramatic episodes of high and low moods do not follow same set pattern. Someone may feel the same mood state, depressed or manic, several times before switching to the opposite mode. There are episodes can happen over a period of weeks, months, and sometimes even years. How severe it differs from person to person and also change over time become more or less severe. Symptoms of mania, the high. Excessive happiness, hopeless, and excitement. Sudden change from being joyful to being irritated, anger, and hostile. Restlessness, rapid speech and poor contraction. Increased energy and less need to from sleep. Unusually high sex drive, making grand and unrealistic plan. showing poor judgment, drug and alcohol abuse, before becoming more impulsive, less need from sleep, less as appetite, larger larger sense of self-confidence and well-being, being easily distracted. During depressive period, low, the person bipolar disorder have sadness, low energy, feeling of hopeless and worthless, not enjoying things they once liked, trouble in constructing, forgetfulness, talking slowly, less of sex drive, inability of feel pressure, uncontrollable crying, trouble making decision, irritability, needing more sleep, insomnia, appetite change from make you lose weight, although of they died or suicide, attempting suicide. Bipolar disorder causes. There is no single cause of bipolar disorder. Researchers are studying how a few factors may lead to in some people. For example, sometimes it can simply be a matter of genetics, meaning you have it because it's run in your family. The way your brain develops may also play a role, but scientists are not exactly sure how or why. A combination of medical and mental issue is also more common in women. There are medical issues can include thyroid disorder, migraine, and anxiety disorder. Some things that make you more likely to have bipolar disorder include having a family member with bipolar disorder, going through a times of high stress or trauma, drug or alcohol abuse, certain health condition. Many people with the condition abuse alcohol or their drugs. When manic or depressed people with bipolar disorder are more likely to have seasonal depressions, coexisting of anxiety disorder, post-traumatic stress disorder, and abusive compulsive disorder. Bipolar disorder diagnosis. If someone you know has symptoms of bipolar disorder, talk to your family doctor or psychiatrist. Will ask questions about mental illnesses that you or person you concerned about have, have had, and mental illnesses that run in your family. The person will also get a complete psy- psychiatric evaluation to tell if they have likely bipolar disorder or other mental health condition. Bipolar disorder treatment. Bipolar disorder can be treated. It is long-term condition that need ongoing care. People who have four or more mood episodes in a year or who have drug or alcohol problem can have form of a illness that are much harder to treat. Lifestyle changes may have also helped. Get regular exercise. Stay on a schedule for eating and sleeping. Learn to recognize your mood swing. Get support from your friends or groups. Keep a symptoms journal or chat. Learn to manage stress. Find health, healthy hobbies or sports. Do not drink alcohol or use rec- recreational drugs. And that's all for my report, Bipolar Disorder. Thank you for listening.